Today, we will be broaching the topic of cervical cancer, one of the few cancers that, if caught in time, can be cured. Let me tell you my story. At 14 years of age, my daughter was terrified of needles. And when I suggested to her that it was time I took her for her HPV vaccine, she burst into tears. So I had to sit her down and tell her what had happened to me. In my 30s, following a routine smear test, I was diagnosed with precancerous lesions on my cervix. An excruciating cone biopsy followed to determine the extent and severity of the spread. When the results came back, they were not what I was hoping to hear. So I was rushed in for immediate laser surgery to remove the affected area. An intervention that thankfully saved me from developing full-blown cervical cancer. Unknowingly, at some point, I had contracted one of the human papillomaviruses, or HPV. This is the name given to a very common group of viruses, some of which are called high risk, because they are linked to the development of certain cancers, such as cervical, anal, genital, and cancers of the head and neck. How do you contract HPV? Well, it's very common and can be transmitted through any kind of sexual contact with another person who already has it. There are more than 100 different types of HPV and around 40 that affect the genital area. Interestingly, most people will get an HPV infection at some point in their lives. Cold sores fall into the same group, with their bodies eliminating the virus without any treatment required. But for some infected with a high-risk type of HPV, the body will be unable to clear it. Over time, this can cause abnormal tissue growth, as well as other changes, which can lead to cancer if not treated. Cervical cancer is the fourth most common cancer in women worldwide, with 604,127 new cases diagnosed in 2020 alone. In Southern Africa, cervical cancer in women is listed as the third most common cancer, accounting for 12,333 cases and 6,867 deaths in 2020. This according to Globocan. This is further borne out by the rising number of cases, with cervical cancer being the most common cancer seen at the Gynecological Cancer Unit at Groote Schuur Hospital in Cape Town. So, what is the HPV vaccine and how does it offer protection? Currently on the market, the HPV vaccine, its name is also Gardasil, is said to protect against 80% of the virus types most associated with developing cervical cancer. The Centers for Disease Control recommends the vaccine be given to girls and boys between the ages of 11 and 12, ideally. 2 doses spaced 6 months apart are required for total efficacy. But what about for those of us who did not receive the HPV vaccine in our younger years? Remember, HPV infections do not cause any symptoms, and most people will not even know they are infected. This is why regular screening, annually if possible, is a must. Also noteworthy, should you have already contracted the HPV virus in any form, the vaccine is unlikely to be effective for you. So now, should you contract cervical cancer? Let's talk about treatment. Sadly, over 75% of women with invasive cervical cancer in South Africa present with locally or systemically advanced disease, thus requiring chemoradiation or surgery. Treatment costs can range anything from 36,000 Rand to over 900,000 Rand, which likely explains the high death toll South Africa is experiencing as a cause of this disease, as a large percentage of the female population does not have medical aid. For those who do belong to a medical scheme, upping your illness benefit with additional gap cover specific to female cancers might be worth considering. There are many options to choose from, My preferred choice would be the female cancer cover provided by Total Risk Administrators. From as little as R135 a month upon detection, the scheme will pay out a lump sum to you within 48 hours of you lodging the claim. Well worth the investment, in my view. Given my personal experience, I remain ever grateful to medical science for coming up with a preventative measure in the form of this HPV vaccine so that our daughters and theirs do not have to deal with the trauma of developing this deadly cancer. So how does my story end? Well, in the end, having listened to all that I had gone through in my early 30s, my teenage daughter agreed that prevention is better than cure and dutifully accompanied me to the clinic for her 2 doses of the vaccine. Thankfully, she is now afforded a measure of protection against this cancer. But just remember, as the vaccine is currently only effective against 80% of HPV viruses, regular screening is still required for girls once they become sexually active.